Joint resurfacing. What is joint resurfacing? Arthritis can take its toll on the major joints of the body, causing debilitating joint pain and interfering with function and range of motion. The root of the problem in the case of this condition is the degeneration of the cartilage in the joints, resulting in bone-on-bone wear and tear. Joint resurfacing is a technique that addresses the complications associated with arthritis. The goal of these procedures is to resurface the bone where the cartilage has deteriorated. During joint resurfacing, depending on the extent of damage and staging of arthritis, your surgeon will either resurface your knee partially or totally, which involves removing the damaged cartilage and resurfacing with a smooth polished implant placed with accuracy and precision. Benefits of bone resurfacing. Knee resurfacing is done in a minimally invasive fashion, preserving your muscles, ligaments, tendons, soft tissues, and just resurfacing the joint by removing minimal bone. After you've recovered fully, you'll be able to return to most or all of your previous physical activities.